great vendors on the site, and we have so many beautiful names, and this name is right up there with it. I think Healing Threads is gorgeous name because it really does allude to the fact of what these garments do. So Peg, let's first start with who you were before you started this company. So welcome to the lounge, and tell us who you were before you started Healing Threads.
Okay, well, thank you. It's a pleasure to be here, and I appreciate you wanting to actually interview me. So I've been interviewed by many people, but never this way. So this is exciting. Let's see. It's a long story. However, before this, directly before this, I was a commercial interior designer. I had a staff of people, and we had been voted the top 25 interior design firms in the Boston area by the Boston Business Journal, et cetera, et cetera. So it was a pretty successful group. So I started it about 1980 or so, when I was about 5. Not really, but so I started that. I had been a teacher, a 5th grade teacher, but then things happened, and I decided I wanted to go into interior design, so I did, and ran that for about 30 years. Well, no, maybe 25. So anyway, then in 2002, I was diagnosed with cancer. So, and went through all those treatments. I had melanoma. Anyway, did the surgery, did radiation, did interferon for a year. And 6 months after that, my sister was diagnosed with stage 4 colon cancer at the age of 41 in California. I'm in Massachusetts. Yeah, so young. So that's part of the reason we started Spirited Sisters, which is the name of the company. The legal name is Spirited Sisters Incorporated. And our company has come to be known as Healing Threads because of the garments that we manufacture.
And they are lovely. So, we talk a lot about going into treatment or going to the hospital, and you put on that robe that's either too long. And you and I had discussed once before about the, who's worn it before, and, all of that stuff. The smells of other people, the smell of the hospital, the smell of the center. And it does kind of affect you mentally. It gives you a stigma. So you created these garments, and you're wearing one now. But
the story behind the garments actually was I was being treated at one of the major Boston hospitals, and I was being radiated at one particular one. And, it was your basic underground, horrible waiting room. And what I would usually do is valet my car, which was for free at the hospital. I'd valet the car. I went late in the afternoon. I'd run in. I would get there about 5 minutes before my appointment. I'd do my thing and run out. The whole thing took about 20 minutes. One particular day, they had 7 radiation machines, and they were going all the time, which was frightening for one thing. And one of the machines went down, and I was given a choice of either adding a day to my already long list of days that I had to be radiated, or wait. So I decided to wait. I was there. There was no reason for me to leave. So I waited, and that gave me an opportunity to look around and look at the other people. Now, some people came with an entourage, and they'd be sitting there laughing and joking. And the person who was being radiated would be sitting there in a hospital gown. And the others had their street clothes on. So right away, there's the defective one. There she is, or he is, wearing a hospital gown. I thought that was pretty
You just gave me the goosebumps. You literally gave me the goosebumps when you said that, because I can picture, I come with an entourage when I go to treatment and when I go to surgery. And you're right. That's how I feel, and sitting there in the hospital gown, like, oh, there she is again.
Yeah, exactly. We know who you are. We're not looking at your face at all. We're just looking at the hospital gown and how poorly it fits you. Well, there was a woman in that same situation sitting not too far from me, and she was wearing a hospital gown that obviously didn't fit her because she was squirming and pulling and
Yeah.
scrunching down and trying to make this thing fit her and cover her. And of course, they're all tissue thin and the place is all cold. So she's shivering now too. And I was just horrified that anyone who's sitting there ready to go into a big room with this ginormous machine over you, which is frightening to begin with. But then to have a hospital gown as your only protection was ludicrous. Then right to the side of her was an older gentleman, snow white hair, looked like a judge, sitting straight up in a hospital gown, ramrod straight, knees together, feet together, in those socks with garters and wingtip shoes. And he was just staring straight ahead. He wasn't making eye contact with anyone. He didn't want to be there. He knew he had to be there, but he didn't want to be there. And I just took a look at that and said, are you kidding me? Now, I didn't wear a hospital gown because I went in, my melanoma was on my arm. So the first day there, when they handed me a hospital gown, I said, I don't need this. I had a sleeveless shirt on with a sweater over it, took the sweater off, and they said, oh, okay, yeah, you don't need one.
Right.
Well, hello. So I went back to my sisters and said, okay, we're starting a company. It's going to be called Spirited Sisters. And our mission is to enhance the environment in which people are asked to heal and recover. Now, I knew there was no way I could get in and redo waiting rooms and all of that. So the best environment when you are in a cancer situation is yourself. You're the environment. So let's give something to people to make them feel respected, dignified, and modest, keep their modesty when they're going through these horrible treatments.
This is so true.
We did the whole prototype thing, and we conquered. And it's been a long struggle, but we finally started selling in 2006. My sister passed away. She had been given 6 to 12 months to live. And she actually made it to 35 months before she passed away. And she left a 9-year-old daughter and a not so wonderful ex-husband. And Lily is my niece, and she's now being raised by my other sister, the other spirited sister in Georgia, and she's doing extremely well. She's
and that's the name of one of your gowns, right? The Lily. There's a
yes, the treatment robe is a mammography robe that that when you wear it, you know when you go in and you have the mammogram,
yeah,
they give you one of the horrible hospital gowns.
And you know what always cracks me up? It's pink. Ours are all pink. I'm like, seriously, why do you have to make this pink? Like, I don't really want to have pink on while I'm having this done.
Exactly. It's crazy.
It really is.
This is the Lily treatment robe, and we made it with extra deep sleeve armholes, so that when you take one arm out, they always say take one arm out, and then the other one falls off, so you're standing there pretty much naked. But this stays on. This one shoulder will stay on. They do the mammogram for one breast, then you put it back on, and then you take this off. But it's very easy to get on and off. This is one of our prototypes. We have since changed this attachment here to a Velcro strip. So instead of having a tie, and it's
that's smart. That's very smart.
And we have these in three sizes. This size, which fits extra small to large, and then we have another size that fits extra large to 3XL. And then because a customer requested it, we do have a couple of 5XLs for.
And I will tell you, they're very soft.
They are very soft. Well, that's right. That was one of the characteristics we wanted for our garments. We wanted them to be drapable so that they would fall nicely. We wanted them to be heavy enough that you couldn't see through them. We wanted them to be washable, and they are washable and dryable in your own washing machine and dryer. And we wanted them to be soft. and silky, and they're 100% microfiber polyester, and they're just luscious.
Yes, and people shouldn't, when they hear polyester, sometimes they're like, oh, I don't want polyester, but it's the microfiber polyester. It's a different fabric. It really is very breathable and very comfortable.
And it makes women feel pretty when they put it on. Not just the Lily treatment robe, but the healing threads. I am wearing one of the original shirts. I call them shirts and pants. We make shirts and pants. And this has all the bells and whistles of all of them. So this goes on very easily. I'm wearing a shirt underneath because I don't think anyone needed to see what's under the shirt. Okay, so it almost falls immediately into place.
Yeah.
When you put it back on. And then if you have a porta calf, you can just pull down on either side, wherever your porta calf is, pull down on either side. And instead of pulling your shirt down or taking your blouse off or whatever, you just have to pull this down a bit. If you're in the doctor's office being examined after surgery, you just have to pull one side or the other down. In other words, you don't have to sit there stripped from the waist up. You know how they hand you the hospital gown?
And some hospitals don't even hand you a gown. It's a paper, like jacket. That one's the worst. I mean, it literally is the worst.
Yeah. What it does is it sort of strips you not only of your clothing, but they strip you of your dignity and they strip you of your individuality. You could be anybody. If you have one of those hospital gowns on, they look at your wrist to see what your name and your date of birth is and all that stuff, but they don't look at your face. They're looking at this and they're looking at the hospital gown to determine who you are. You are a patient. And we don't really have to bother knowing your name or anything about you. We're just here to treat your body. And I've often said that in the Hippocratic Oath, it says, first, do no harm. But I contend that putting people into a hospital gown is harming them emotionally, physically, certainly, because you're not going to get well fast in a hospital gown. You have to look good in order to feel good. And putting someone in an innocuous, typical hospital gown when they're being treated for anything, even a cold, is just not respectful, and it's doing harm to the person. Like, okay, they don't know who I am, I'm just a body. Right. And that's pretty much, not criticizing them, but because they're also busy and backed up with patients and all, but still there's no human touch. And this gives you a human touch. I had a customer say to me, when I put on my healing threads, it's like someone's giving me a hug.
I love that you say that. That is one of my favorite comments. I just love it. Love it, love it, love it. And it's true, because when you're wearing the other stuff, you feel it's almost like a violation. Like you don't know who wore it before, and what you and I discussed that before. What happened to that person before? This is your own piece of you coming from your house with your smells and your, everything.
Yep, absolutely. And I like to think that it also, if you can say no to a hospital gown, it gives you a sense of power. Because when you're diagnosed, someone looks across at you and says, you have cancer, immediately you freak out. Internally, externally, however, but you freak out. And you will do anything they tell you to do. And if one of the things they tell you to do is put this on, you're going to put it on. But if you can say to them, when they're telling you what scans to have, what tests to take, where to go, what other ologist to go see, you can say, wait a minute, I'm part of this. I have my own hospital gown. I have my own, I like to call it hospital attire or patient attire. I have my own. I don't need yours. So you're kind of becoming involved with the whole procedure and not just someone who's having something done to. So I like to think that it empowers you if you have your own clothing. Now, hopefully that progresses to, okay, all right, you're telling me I have to have this, this, and this. Well, why? Why do I have to empower yourself? it will lead, hopefully it would lead to empowering yourself to learn more about what's going on in your own body and what you can do to help it. You know, there's alternatives, there's complementary therapies, all of that. And all of that is very important for you to be involved in what's happening to you.
Well, Peg, I think you're actually right, because if you're wearing your own clothes, you can be yourself and you can be more assertive. But the minute you put that hospital gown on, you do become more of the patient and almost childlike. And you're, you know, okay, yes, okay, yes, okay, yes. But if you're in your own clothes, you can take a little bit of yourself back. And that really is a great analogy. And I always say to, you know, people that are, you know, come to me for support,
right.
There's so few things that you can control during your diagnosis. So few things. So if you can find things that you can control, do it and embrace it and take hold of it, take charge of it. This is one of them. You can control what you're wearing to treatment, to your mammogram, to, you know, surgery, to whatever. You can control that. You don't have to put that on. You don't. I remember the first time I wore my own robe, and it was to the radiologist, and she went to go hand me a gown, and I said, no, I have my own. And she looked at me and she was like, you got your own? And she walked out, and then she came back. She goes, I got to tell you, I've been a nurse for 25 years. I have never seen anyone come in with their own robe. This is awesome. She loved it. Yeah. She wasn't offended by it. She did it. She wasn't like, oh, she's got her own robe. She thought it was great. Yeah. And she told other patients
Every time I go to any doctor's office, I wear this in. The elderly really appreciate this too. Or anybody who has small motor control issues or balance issues, have to take their clothes off and then put something else on. It's a struggle. So I did this with my mother at the time, was in her 70s and had some balance issues. So I gave her this, and she could go. She was of the World War II generation where everything is, you know, covered from head to foot, blah, blah. But she could put this on so easily and wear it. She didn't need underwear underneath because you can't see through it, and it's very, very warm. And so she was able to wear this, and she didn't have to change when she got to the doctor's office. And then she could just take herself home, or whoever was with her would take her home, and then she could, you know, wear it all day or wear something else. But the fact was that she did not have to change her clothes when she got to the hospital. She had her hospital gown on. They didn't have to remove it. Mm-hmm. They have the panels, and if there's an opening in the back for anyone who's having chemo, they can just listen to the breath sounds. And even my mother sitting on one of those exam tables, they need to hit the skin with the stethoscope. The panel, the back opens, so that's, you don't have to pull the shirt up or take it off or any of that. And one other thing that I wanted to mention too was, in days gone by, we have a certain relationship with breast care patients. They love our garments. We have about 20 hospitals in the country who buy them and give them to their mastectomy patients as a gift for them to take.
Wow, that is amazing.
Amazing, amazing. And what happens is, and I've spoken to a number of women who have done this, they love them. Then when they have a friend or a relative who's diagnosed with breast cancer, they pay it forward. They give it to them. So, I mean that doesn't help me.
No.
Fiscally, but it just warms my heart that these are being passed around the country. You know, I got off the phone with a woman yesterday who was ordering another one because she goes to a lot of medical appointments, and she wears them all the time. And just as you said, she'll go in for a mammogram, and the texts are like, oh my God, what is this? Where did you get it? This is fabulous, you know. So
well, I had a client on CureDiva that a class pitched in money and bought one of your robes.
Really?
And they embroidered the teacher's name on it for the teacher. And I just thought that was so sweet. They put, I think if memory serves me correctly, that they called the teacher something. I don't remember what it was, like Lollipop Lady or something like that. And they embroidered that on there. But to me, what a great gift. Like, seriously, what
Oh.
a great gift. And that is one thing on, you know, with CureDiva, when I have clients that, you know, my sister's going through chemo, what can I get her? I show them these garments because you know, it's hard to pick out a head wrap. It's for somebody else. It's hard to pick out things like that nature. But this is something that they can use, that they will use, and it's something that most women don't even know is out there.
I know. And you know, we've been around for 9 years, and it's like, what do you mean you don't have never heard of us? You know,
Right.
that's crazy.
Well, Peg, hopefully we can get the name out there a little bit more. So thank you so much for doing this and taking the time today. I know you're very busy, and we will continue to, you know, help you and broadcast you and put it out there that Healing Threads is just a fantastic piece of hospital attire. I love that title, and that's what I'm going to be using. So thank you so much.
And thank you to CureDiva, because our name is getting out there faster because of CureDiva. So I appreciate
thank
everything
you.
that
I
you've
just
done
love
for
our
us.
community. So thanks so much.
I do too.